Stay healthy, only on Health on Traxx.
Good morning, hi there. Welcome to Health on Traxx Midday Buzz on Mondays. As you know, different days from Mondays till Thursdays, different topics on the Midday Buzz. And today, the 5th of May's edition of the Midday Buzz, well, it is Health on Traxx. Our topic for today, something which probably might just interest you, hemorrhoids, the common enemy. And we'll be talking to Dr. Mohd Fadhil Ahmad Nazlan, who's the Consultant General Surgeon, UiTM Private Specialist Centre, in the studios with us. A very good morning to you, Doctor. Doctor, hi. Welcome to TRAXXfm. How are you today?
Good morning, Gilbert. How are you?
Not too bad, Doctor. Not too bad. Really interesting to, meet somebody like you today, especially on a Monday, starting off the week. And with a very interesting topic, Doctor. Doctor, before we go on, could you just tell us a little bit about yourself?
Okay, I'm Dr. Fadhil, currently practicing as a general surgeon in UiTM Private Specialist Centre.
All right.
It's an honor for me to be here today.
Thank you.
Because I'm from Pahang, Jerantuk Pahang.
Okay.
When I was small, there are a few very limited choices of radio that we can hear from there.
Okay.
One of it is TRAXXfm. So it's a pleasure to be invited.
Thank you so much, Doctor. I believe it's your first time, right?
Yeah, my first time.
Welcome to the airwaves. Line, it's always different when you're on radio and things like that. Okay, Doctor, besides what you do for professionally, could you just tell us a little bit about our topic today? Probably our listeners, for those of you who happen to be tuning in to TRAXXfm right now, Health on Traxx. And if you're not on the frequency airwaves, you can also check us on social media platforms. Facebook, it is TRAXXfm. We are also on YouTube, that's TRAXXfm Official. TikTok, TRAXXfm Official. And if you have any questions, probably for the doctor, the good doctor today, well, you could just post it on our socials. So there you go. And doctor, all right, getting into our topic today, could you explain to us, what are hemorrhoids?
Okay, hemorrhoids, or some people call it piles, or in Malay, buase, is actually swelling of the anal cushion. Mm-hmm. Now, what is anal cushion? Anal cushion is a part inside the anus, which contains smooth muscle and blood vessels. Mm-hmm. Mm-hmm. Now, the function of this anal cushion is actually to help us in controlling our bowel motion. It helps us with the continence. So now, any reason that cause increase in the blood pressure inside the vessel in the anal cushion can cause hemorrhoids. Now, typically, hemorrhoids can be categorized into a few categories. Internal hemorrhoids, external hemorrhoids, and a mixture of internal and external hemorrhoids. Now, for a surgeon, it's important for us to differentiate between all these categories because the management are different, and the way we categorize it is basically from our thorough investigation.
Okay. All right. So explained by Dr. Fadhil with regards of what hemorrhoids are and the various types of situation that probably you might face. How common, actually, doctor, is hemorrhoids? when it happens?
In the studies, it has been reported about 17 to 20% of population have hemorrhoids. But I believe it's actually underreported. Mainly because people often consider hemorrhoids a private matter. So they don't often share regarding their problem until the problem has become more severe. In fact, not many health practitioners wants to talk about hemorrhoids because it's a private matter. In my practice, we do see around 30 to 40% of patients coming into our surgical clinic actually have hemorrhoids. It's just a matter of whether they complain of any symptoms about it or not. But after further investigation, we find that it's more common than being reported.
Okay, so that's how common it is, and many of us probably leave it as something personal. We're too embarrassed to talk about it or something like that. But don't, okay? If you happen to be with us right here on Traxx FM, any questions that you would like to throw about, well, I have my producer Chenta together with Zam in the studios with us on Facebook, Traxx FM, YouTube and TikTok. It is Traxx FM official. Talk to us if you have anything that you would like to ask Dr. Fadhil. Doctor, moving on to our next question here. Now, what are the symptoms of hemorrhoids, doctor? Could you just explain to us on this?
Well, there are two main symptoms of hemorrhoids. One being a patient complain of passing out blood from their anus. And the second one is they feel a swelling coming out from their anus. Now, like I mentioned, the reason for hemorrhoids to occur is because of dilatation of blood vessel in the anal cushion. Now, any tear in that anal cushion will cause bleeding. Now, this bleeding often are fresh blood dripping down into the toilet bowl and not mixed with their stool. So when patient complain about these symptoms, we as surgeon will ask a detailed question regarding these symptoms. We perform a thorough physical examination and plan for investigation because these symptoms can mask other more sinister condition, for example, colon cancer. So further investigation, checkup needed to make sure that the problem is because of hemorrhoids and not because of something else. The other symptoms is they feel something swelling coming out from their anus. We call it prolapse hemorrhoids. Now, there are 4 clinical stages of these hemorrhoids. One being just dilatation without any swelling or protrusion coming out from their anus. 2 is they feel the swelling coming out, but the swelling reduce spontaneously without doing anything. 3 is it comes out, patient has to manually reduce the swelling inside. And grade 4 is it comes out and it stays out. So it's important for us to differentiate between this grading because different grading has different management. And then the purpose of us investigating further to see the grading because without early intervention, patient need a more sort of bigger surgery to control their problem. The other symptoms that a patient often complain is discomfort and itchiness around the anus.
Right. Doctor, just now when you just said about there are different stages of the situation, right? Hemorrhoids, right? One of the situation which you just mentioned was about while it appears or it is there and then it dissolves or it goes off. And that's not a big issue to certain individuals. How does it dissolve? How does it go off? I mean, it's something that is not going to be there forever, or it is something that is there temporarily?
The anal cushion or the dilated anal cushion or hemorrhoids are actually inside the anus, inside the anal canal. So when we strain when we pass our bowel motion, the hemorrhoids tissue will goes down together with the stool. And naturally it will goes back in. But if the hemorrhoid tissue become bigger, then it will stays out. It cannot go in anymore. So they need to either reduce it manually using finger, or in grade 4 they cannot reduce it anymore because of the swelling is more severe.
Okay, so there you go. Different grades of hemorrhoids. Doctor, one last question before we take a short break. What are the cause of this particular problem, which is hemorrhoids? What actually causes it?
Okay, there are many causes of hemorrhoids. The main one is constipation. So when patients have constipation, they have to strain more to pass their bowel motion.
Right.
This will lead to an increase in the blood pressure inside the hemorrhoids tissue. The other cause will be any increase in the abdominal pressure. That's why hemorrhoids is quite common in pregnant ladies. Okay. Patients who have other medical condition, for example, end-stage kidney failure, heart failure, liver failure, they have fluid accumulation in their abdomen, so the abdominal pressure is higher. This will lead to increase in the blood pressure in the anal cushion down there, which will lead to hemorrhoids. The other thing is improper toilet habits. Now, we often hear about good sleep habit or good sleep hygiene, by which you have to, go through certain routine in order for you to get a good night's sleep.
Right.
But you rarely hear about good toilet habit.
Right.
Okay, what is good toilet habit? Nowadays, we see a lot of people are spending more time in the toilet, sitting on the toilet bowl, playing with phones.
All right.
Without realizing that you are actually exerting more pressure down there. This will lead to increase, the blood pressure in the anal cushion is higher,
right?
Which can lead to hemorrhoids. That's why those days we often see hemorrhoid in middle or older age group.
Okay.
But nowadays we often see hemorrhoids in younger age group, in teenagers as early as 14, 15 years old because of this improper toilet habit.
Right.
Yeah.
Toilet habits. Yeah. Reading a book in the toilet, I think, is not a problem, right? Don't with your phone. Yeah.
So what I can suggest is you sit down a toilet bowl when you really have to go to pass your bowel motion, without any other reason being there. Playing phone while waiting for you. I mean, it's just a habit.
Okay. Okay.
So if you have that kind of habit, if possible, try to change it.
Try to change it.
Because this problem won't happen in one day. It's rather a long, accumulation of improper habits for a long time.
All the time.
That can lead to hemorrhoid problems later on in your life.
I understand, doctor. All right. So there you go. Practicing good ethics, especially when you are easing yourself, and the symptoms. How common is hemorrhoids? There are 4 different categories. We were talking to doctor about it. And of course, what is it all about, which is hemorrhoids? Once again, hemorrhoids, the common enemy. And today we're talking to Dr. Mohd Fadhil Ahmad Nazlan, who's the Consultant General Surgeon, UiTM Private Specialist Center. Thank you so much for the first round of questions. Now, don't go anywhere, because when we come back, the investigations that surgeons do for hemorrhoid patients and medications for hemorrhoids, laser surgery, so on and so forth. So these are the questions which we'll be talking to Dr. Fadhil in a bit. Stay tuned. Held on Traxx, Midday Buzz, today's edition, the 5th of May. Back in a bit. It's the midday bus right here on Traxx FM. Today's edition, the 5th of May. Thank you so much to our listeners who are still together with us. And if you would like to ask our good doctor, Health on Traxx, that's our topic for today, which is hemorrhoids, the common enemy. On Facebook, it is Traxx FM. Talk to us if you have any questions, if you'd like to ask our good doctor in the studios, or probably catch us live on YouTube and also on TikTok. That is Traxx FM official. Talking to Dr. Mohd, Fadhil, Ahmad, Nazlan, who's the Consultant General Surgeon, UiTM Private Specialist Centre. Haemorrhoids, the common enemy. Welcome back to the show, Doctor. Good morning.
Thank you.
Doctor, we were talking about the introduction to hemorrhoids, common factors, the categories of hemorrhoids, and what causes hemorrhoids. Jumping into our next question here, Doctor. Now, what are the investigation or checkups one can do that surgeons do for hemorrhoid patients? Could you explain a little bit on that one there?
Okay, after taking a detailed history and perform a thorough physical examination,
right,
we often will introduce a proctoscopy inside the anus. It's a small device to directly visualize the hemorrhoid tissue, whether the anal cushion are engorged or not. Subsequently, we often arrange an endoscopic examination by which we will put a camera inside the anus to check the whole large bowel. Now, there are a few reasons of us doing that. Number one is we have to rule out other more sinister conditions like bowel-related cancer that can mimic the symptoms of hemorrhoids. Number two, we need to see the type of hemorrhoids, as I mentioned, internal, external, or mixture of both, because the managements are different, and the size of the hemorrhoids itself. Because a large hemorrhoids have to be tackled using different strategy as compared to the small one.
Okay. All right. Thank you, doctor, for the explanation. Very detailed there. And is there any medication for hemorrhoids? Let's talk about the medication part first.
Okay. We often start medication, Dysmin, Hesperidine. This medication, there are a lot of in the market with different names, but basically the properties of this medication is to reduce the venous blood pressure in the anal cushion. Well, this medication is actually suitable for small ones and grade 1 hemorrhoids. If the size is small, grade 1, with medication, these hemorrhoids can resolve. However, it's not really suitable for grade 2 onwards. Yes, it can reduce the severity of the symptoms, but the hemorrhoids itself won't go away, often needing more intervention like rubber band ligation, laser treatment, or even an open surgery.
Okay. Doctor, we have a question here from one of our listeners. Najib Nawi, thank you so much, buddy, for your question here. Najib just happens to be one of our regulars. Okay. How do we avoid hemorrhoids after successfully treating it, doctor? Is water consumption a factor?
Okay. Yes, we have to maintain a good, healthy diet.
Okay.
Water intake is important. If you don't have any contraindication to take water, you know, for example, if patient have heart failure and stage kidney failure, they have daily limit of water intake.
Right.
If you don't have this condition, we have to maintain at least 1.5 liter water per day. Because adequate water intake will ensure that your stool is not hardened, so that you don't have to strain more while trying to pass your bowel motion. Hence, the risk of hemorrhoids is lesser. Fruits intake, fiber intake are important for the same reason.
Yeah, so this is the topic that I was having a personal chat with doctor, and besides medication, what are the other factors or other foods that we can take? And doctor did mention about natural food, which is being a lot, which is fiber based, right, doctor? And preferably lots and loads of water. Is laser surgery suitable for patients with hemorrhoids, doctor?
Okay, laser surgery works wonderfully for for grade 1, grade 2, and some grade 3 hemorrhoids, provided that the type of the hemorrhoid is internal or mixture of internal or external hemorrhoids. Okay. So basically what we do under anesthesia, by which patient cannot feel anything down there anymore, we will make a small 1 cm incision, small nick around the hemorrhoid tissue. Then we will introduce the laser device. We will utilize the heat from this laser device to burn off or kill off the hemorrhoid tissue. It works in terms of pain control. Post-operation, it is much better as compared to open surgery. The risk of infection is much lesser. In fact, my patient who underwent this surgery, they can live their normal daily living after day 1 post-operation. However, this laser surgery is not suitable for external hemorrhoid or grade 4 hemorrhoid, by which it goes out and stays out. As a standalone surgery, we often have to mix a few type of surgery to settle this problem.
Okay. So there you go. The difference of using laser and other methods when it comes to surgery. What is the alternative surgery for hemorrhoids besides laser? And as you mentioned, doctor, is there anything else that we need to know about this when it comes to alternative surgery?
Okay. If patient present with prolapse hemorrhoids, meaning the swelling protrude out from the anus, not much of bleeding, we can actually restore back the anatomy. We can use a stapling device to actually push back the hemorrhoid tissue up and restore the normal anatomy, so that the swelling won't protrude out as much as before. Okay, that's number 1. Number 2, we have this technique of open surgery. We call it hemorrhoidectomy, by which we will excise the whole hemorrhoid tissue. Now, if you can imagine, laser surgery involve a 1 cm incision. Open surgery, basically 2/3 of the, we have to perform incision about 2/3 of the anal canal to remove the whole problematic hemorrhoid tissue. Now, if you can imagine, the risk of bleeding is much higher. The risk of infection is much higher, and also the pain is much higher. That's why it's important to seek medical attention if you have this hemorrhoids problem early on, before your hemorrhoids become a grade 4, that needing a bigger surgery with a higher
risk factor.
Yeah.
I understand, doctor. Thank you so much for all the explanation. Something that doctor said, while being 18 to 20% is just underrated, the percentage is much higher, right, doctor?
Yeah.
And topic for today, hemorrhoid, the common enemy. Talking to Dr. Mohd, Fadhil, Ahmad, Nazlan, who's the Consultant General Surgeon of UiTM Private Specialist Centre. Thank you so much, Doctor. Doctor, is there any additional message that we'd like to extend to our listeners today? Some advice from your side, Doctor.
Okay. First, take a healthy diet. Ensure you have adequate water intake per day if you have no underlying medical problem. 2, please have a good toilet habit.
Not 2 hours.
Not 2 hours on the toilet bowl. Just go when you need to go. 3, if you have this problem, don't be shy to talk to us, because the earlier you come to see us, the smaller surgery, you need a smaller surgery, laser surgery.
Right.
If you come to us later with grade 4, then you need a bigger surgery with much problem later on.
Okay, basically what doctor is saying, when you have it, or when you have the situation like this, do not feel embarrassed to talk to your professional doctor. And yes, early detection, while looking to the matter much earlier on, plays a very important role, and don't make it worse later. Thank you so much, Dr. Mohd, Fadhil, Ahmad, Nazlan, who's the Consultant General Surgeon, UiTM Private Specialist Centre. Hemorrhoids, the common enemy. And while that is all the explanation that our good doctor has for us today, it is Health on Tracks every Mondays and the midday bus today, the 5th of May. Thank you so much for joining us. And to our listener, thank you for your questions. Now, for those of you who just happen to join us or get on board, this is the Midday Buzz. Thank you to my producer, which is Chenta, and also Zam in the studio with me. I'm Gilbert with you till 3 this afternoon. Stay tuned for more good music. We got news coming up at midday.